Yes, good afternoon to you all. I'm Emmanuel, and I'm going to do a presentation on adherence to antiretroviral therapy among people living with HIV and AIDS in Monze and Nyimba districts of Zambia. A summary of my presentation. This study reviewed that about 83.5% of the participants in this study had high adherence to antiretroviral therapy, whereas about whereas about 16.5% had low adherence to ART. When it came to the factors that affect adherence, knowledge and the ART clinic site were statistically significant associated with adherence to ART in this study. So this study will contribute to improvement in adherence to ART and reduction in treatment failure, leading to good treatment outcome for our patients. The background: the human immunodeficiency virus and acquired immune deficiency syndrome crisis is the worst the world has ever experienced. When we talk about Zambia, about 13% of adults aged 15 to 45 years are infected with HIV, and with an estimated about 30,000 deaths. Zambia started the free ART drug provision in public health institutions in 2004 to help clients who are unable to sustain the cost of ARV drugs. There are approximately 75,000 people living with the HIV/AIDS on ART, and only this represents about 63% of the people in Zambia who need the ARVs. You would agree with me that the control of HIV and AIDS depends on several factors, which include lifelong treatment to ART. Although provision of ART has been a major stride in the mitigation of HIV and AIDS in Zambia, adherence to ART among all those on ART needs more attention, as poor adherence to ART leads to serious consequences such as resistance and eventually high morbidity and mortality. WHO recommends that at least 95% of adherence to ART among people living with HIV/AIDS to avoid emergency of resistant strains of the virus. The main objective of this study was to assess the adherence to ART and associated factors among people living with HIV. The methods. This was a cross-sectional study, like I mentioned, which was done at these two sites. The first one is Monze General Hospital in the southern province of the country, and Nyimba District Hospital in the eastern province of our country. The sampling method was a simple random of about 364 consenting participants who were attending our ART clinic were selected between February and March. A structured interview schedule was used to collect data from the interviews and also from the medical record, because we did a bit of some record reviews. Then when it comes to the analysis, the final analysis which we did was the multivariate binary logistic regression analysis using the IBM SPSS for Windows version 20 to ascertain the factors associated with the adherence to ART among the participants. The results: out of the total 364 participants, 83.5%, that is about 304, had high adherence to ART, whereas 16.5, about 60, had low adherence to ART. Then the participants who had adequate knowledge on HIV and AIDS, surprisingly, and ART, were 73% less likely to achieve high adherence to ART compared to those who had inadequate knowledge. And also, the participants who visited the Nyimba ART site were 2.34 times more likely to achieve high adherence compared to those who visited the other site, that is Monze ART site. However, the following variables were not statistically significant associated with adherence to ART, that is staff attitude, the age, sex, marital status, region, education, employment, monthly income, distance, That is from the ART site, waiting time, health status, and also the attitude of the clients. This is the table for the main analysis, just trying to show which variables were significant. Then in conclusion, we'd like to conclude by saying that the majority of the participants had a high adherence to ART, which was associated with marriage and the ART clinic site. And considering that HIV and AIDS, like most other chronic diseases, is progressive, the findings suggest that if the factors influencing adherence to ART are not adequately addressed, then opportunistic infections will emerge and ART regime of the people living with HIV and AIDS becomes much more complex with time. So the study will enable the healthcare providers to review their information, education, and communication, that is IEC, and also care given to people living with HIV to ensure high adherence to ART. What are our future plans? The future steps include the following. One, we suggest that further studies should be conducted to evaluate the type of IEC, that is information, education, communication, that is given to people living with HIV, and also to compare adherence to ART among the different ART sites. Although in this study, our intention was not to do a comparison state between or among different ART sites. These are some of the references where we got the literature from. I end my presentation and I thank you for your attention.